Can we seek treatment from any provider in Grenada under this service?
So yes, in one area and no in another. Now, on the primary care side, we want to put some discipline in the system. I'll tell you about Caribbean healthcare. There's a tendency for people to wander from doctor to doctor. And again, if people aren't satisfied, they have the right to go seek healthcare from whoever they wish. We don't have a problem with that. But what we say to people, we don't want you to abuse the system. What we want is that for a patient to establish an ongoing long-term retreating relationship with a primary care doctor. One of the challenges when people move from doctor to doctor, their medical records don't get transported. The messages that one doctor gets versus the other don't get carried through. So you're doing yourself a disservice. Now, yes, if a doctor can't find out what's wrong with you, it's fair to go to another one. But we want to set up a system where you have the right to go anywhere you want to. But what we believe is that if you get assigned or you pick a doctor and you decide you want to go to another one that's doing the same exact thing, then you should take the responsibility to cover that. Those are the kinds of things we want to put in the system to prevent the abuse. Okay? And again, there are a lot of services that a doctor could do in the office rather than going to the emergency room. But now we have to equip the doctor's office with some of the things that there are people that go to the emergency room in every country for things that could be handled by a doctor's office. So, but for us to be able to implement that, we have to have a better situation in the doctor's office where those services could indeed be provided. So that's part of the changes that we need to see in the healthcare delivery system for us to make that happen. So yes, as far as specialists goes, we want to have a system where there is order, where there are indication why you should go to this specialist. And that's where we need to educate our doctors, and we have a system so that we don't get, a lot of times some people go to specialists and they go to the wrong specialist. They didn't need to go there. So you need a professional, a primary care physician that's very involved with you, that helps you navigate the healthcare system. One of the areas why we increase healthcare costs is because we can't navigate healthcare. We end up in the wrong place. Healthcare is a very complicated business, and you need proper trained navigators. And the best place to do this is in the primary healthcare's office. And we will train primary healthcare, and they'll have personnel that's trained to be able to navigate their way through the healthcare delivery system. And it's not a complicated system, but if we do it right, we can make this extremely efficient.
What is the beneficiary enrollment, and how is that going to work?
Again, some of those we are still working on as far as how we're going to enroll people. But my suspicion is that this is going to take time. And in fact, one of the ministers said to me, Dr. Ned, Grenadians don't like to sign up for too many things. So we're going to have to work with, my view is that we have to work with people where they are. So if you're working, we're going to go to your employer and say, help us enroll. We have organizations like the NIS that could help us. So we have to do this creatively so it doesn't cost a lot of money. I know when we did this in the BVI, it cost a lot of money to register people. But we have to think of ways that we could do this where it's economical and easy for people to, again, we have to reach people where they are. We have to use technology to be able to register people. My view is that we should have an ID card of some kind, hopefully one with a picture, even with a magnetic stripe. So if somebody we want to link it to the bank account, we want to link it to we want to be modern. Let's take a stab at doing this in a way that it's efficient. So, because just by doing some of these things, we're able to cut a lot of admin costs out of the system. So that's going to take some time and some planning, and we've done some work in this area, but we believe that there's a lot of technology available to help people get registered, and so we plan to utilize that.
One of the final questions that we have for you, Dr. Ned, someone from social media again saying that the system that you're proposing, based on what you've said so far, seems to be similar to US, UK models. Can you explain that for us?
It's fascinating that when you study the history and the development of healthcare models and systems, you would understand that many of the models we produce here, so one started in China and the other one started in Cuba. Managed healthcare came out of Cuba, starting with the community health systems that were created. That got transported to South Florida by the Cubans, and it spread to California, and that's how, but the United States put the word on it, call it managed care. But it actually came from Cuba. And the Chinese were some of the first people to implement this type of system in what we call a community health system, where they paid the doctors on a per head basis. So yes, some of that system is used in the United States. But when you go back to our documentation, you would find that we looked at models around the world. There are some elements we adopted of the Canadian health system, providing national health care, that would allow us to be able to sort of sectionize the way that the healthcare delivery system works in terms of modeling the payments from a top-down standpoint. There are the health savings account that's in the Far East is an important model that the Far Eastern countries have adopted, where people would put money in their banks towards healthcare. And that model is we saw from the Far East, and it works very effectively. Employers could do it. So rather than charging a premium, people open up a bank account and they create a savings account, and it acts like a premium. So we've adopted this from here. Some of the European models, like in Sweden and so forth, there are other models. India and South Africa now, we actually looked really hard at some of the stuff that they're doing in healthcare financing, some of those creative things where you have the public and private partnerships. Grenada is going to be one of the unique systems if we're able to execute a true private-public partnership, that we could literally provide this. And I think people in the WHO and the Pan Am and so forth are looking at us and saying, if you guys are successful in developing this type of thing, both from a legislative standpoint, understanding that we adhere to the laws of the country in so doing, and having an NHI authority allows us to do that. So yes, it's not just the United States or Canada or Europe. We've adopted principles from many, many, many health systems around the world.
What are some of the advantages of private health providers contracting with the NHI authority?
Well, first of all, private healthcare providers will be provided a guarantee of payment from the NHI.